being here today at our member webinar for the Global Consortium on Climate and Health Education. My name is Haley Campbell. I'm the project director and I manage sort of all of the events that we have going on at the consortium. So yeah, it's great to see you all today. And today I have the pleasure of introducing our speakers today, who will be telling us a little bit about their climate and health curriculum and medical education, as well as the public health practice. So first, we have Professor Lynn Madden, who's the inaugural professor of population and planetary health at the School of Medicine at the University of Notre Dame, Australia. And we have Renzo Grinto, who's the chief planetary health scientist and co-founder of the newly established Sunway Center for Planetary Health in Malaysia. And he's an associate professor of the practice of global public health at St. Luke's Medical Center College of Medicine in the Philippines. So thank you both for being here and for sharing your expertise with us. And with that, I will pass it along to Professor Madden.
Thanks very much indeed, Haley. So I'll just now go and share my screen and just, sorry. Great, thanks very much indeed. It's always a relief when that happens, isn't it? Thank you very much indeed for the invitation to contribute to this member webinar as part of the Columbia University Global Consortium on Climate and Health Education. And I'm also saying to Haley, I'm very grateful for your compassion in setting it up at this time. Usually things which are at a reasonable time in Australia are therefore not always greatly reasonable for other people. So thank you all very much indeed for setting the timing of this up. My presentation today is about preparing health professions responding through medical education and a new approach to a Master of Public Health program. But I'd like to start by recognising all the traditional custodians of the lands on which we meet. In my case here in Sydney, it's the Gadigal people of the Eora Aboriginal Nation, and I pay my respects to all elders past and present. I will speak specifically from an Australian perspective, and I hope that what I say resonates with you. I will start by providing some local context for both of the programs that I will speak to you about. Over the last 3 to 4 years, we've had compounding climate change-induced natural disasters, extreme drought, extreme heat and heat waves, extreme fire weather, extreme flooding over and over again, at times overwhelming the capacity of our systems to cope and protect people. Sea levels continue to rise, directly threatening the homeland and culture of Torres Strait Islander people and Aboriginal peoples in parts of Northern Australia. A warming ocean causes regular coral bleaching now of the Great Barrier Reef, damaging one of the most diverse ecosystems on the planet and an important source of nutrition for coastal peoples. Vector-borne diseases are extending their footprints, most recently Japanese encephalitis, previously limited to the Torres Strait and far northern Australia, currently causing an outbreak in Victoria and southern New South Wales. The recent 6th IPCC reports confirm that Australia will see more of this and that heat waves will become more frequent and intense, that the intensity, frequency and duration of fire weather will increase, that there will be an increase in heavy rainfall in parts of the country, sea levels are rising faster than the global average, and sandstorms will increase. The health effects of climate change are increasingly well described. The effects of climate change on healthcare systems are less well documented. Consequently, in 2021, the Royal Australasian College of Physicians released this research report they commissioned in collaboration with 9 other medical colleges. This report clearly illustrates the effects of climate change on healthcare systems across Australia and the inadequate piecemeal approach to this from a policy and program approach. I commend it to you, particularly the case studies. Climate resilient and environmentally sustainable healthcare systems are therefore an important part of the solution to the current climate and health crisis. Despite the evidence of the risks to health and to health systems, graduates of health professions education entering the workforce are generally poorly prepared to contribute to environmental sustainability, and currently the capacity of health systems to respond is being limited, at least in part, by the understanding of their workforces. Australian tertiary education must urgently step up and better prepare its graduates for these roles. So first, I'd like to describe the work of a collaboration of medical schools in Australia and New Zealand who have worked together to strengthen environmental sustainability within medical programs in both countries. And I'd just like to acknowledge colleague Michelle McLean, Professor Michelle McLean from Bond University, who is also part of that collaboration, who's linked in and joining us this evening, your time, morning our time. And second, I examined how we have placed an environmental sustainability lens across the development of a new Masters of Public Health program offered by the University of Notre Dame, Australia. I've been asked to share how each of these educational initiatives got started, the current form of the program, and how students have responded. Accreditation standards for medical programs in Australia and New Zealand are currently silent on the environment as a determinant of health. Consequently, in 2018, a collaboration of medical schools across Australia and New Zealand formed a working group that developed graduate outcome statements and learning objectives for schools to use when reviewing their curricula. This initiative got started when a group of concerned medical education academics recognised that as individuals, achieving change in a medical program curriculum is difficult. You struggle to create interest and achieve change, and that there was a need for scale and pace for change. All medical programs needed to embrace climate change and health across Australia and New Zealand. A working group was formed through the medical deans of Australia and New Zealand. This collaboration of medical schools also included medical student associations from Australia and New Zealand, so students were also partners in this work from the outset. By working through existing structures, in this case, the peak body for medical programs, the Medical Deans of Australia and New Zealand, the working group had a legitimacy and accessed existing respected channels of communication. Oh, that previous slide was showed the a publication from 2018 that highlighted the formation and work of that collaboration. Using a variety of evidence sources, the working group determined 5 areas of learning that medical students should know about, and these are listed on this slide. The principles of anthropogenic climate change and how this relates to environmental determinants of health, the impact of climate change on health, the impact of climate change on the health system, the environmental impact of the health sector and what comprises environmentally sustainable healthcare, and creating change both intra and intersectorally through advocacy and leadership. The existing graduate outcome statements of the accrediting body for medical programs in Australasia, the Australian Medical Council, were then mapped against these areas and amendments suggested. Learning objectives supporting these graduate outcome statements were identified from the literature or developed by the collaboration. The results were circulated to medical schools at that time, and schools have used these in various ways to build curriculum. The process that we followed and the results were published in March this year in the Medical Journal of Australia, open access, and so it can be widely shared, and that includes the suggested amendments to the graduate outcome statements and all the mapped learning objectives. This is an example of how health professions programs across universities can support each other to resource and achieve change. However, for change to be achieved at scale, these themes must be included into accreditation standards, because then accreditation standards drive the change. It's not up to individuals. Accreditation standards drive the change. The AMC accreditation standards for medical programs are currently under review, and we have submitted this work to the consultation process and are advocating for this change. The working group continues now in the form of a special interest group and is committed to report on an indicator describing how medical programs are responding. It's very important that we measure what we do. The Medical Journal of Australia, Lancet Countdown, a Lancet Countdown annual reporting partner, will report an indicator on the inclusion of climate change and health into medical curriculum in Australia. We are currently considering how to do this. There are no indicators on the shelf. So essentially the challenge is to determine what to measure and how. Monitoring and measuring has been very effective in forming change in other parts of the health response. And we have the Lancet Countdown to thank for driving that change. I would like to emphasise how essential working in collaboration with other medical schools has been in progressing all of this work. It's also been tremendous in creating effectively a peloton of individuals who can support each other and actually provide each other with advice and energy. So I commend that as a strategy to everyone. Also, this is a multidisciplinary endeavour. This content should be included in the accreditation standards across all health professions. So the second program I'd like to speak about refers that postgraduate public health education also needs to change. A skilled public health workforce is essential for a comprehensive response to climate change. Climate change impacts not only health, but also the economy, the environment, food, water, energy security, jobs, and the integrity of communities, the foundations of public health. Climate change is exacerbating inequality and disproportionately affects the poor, the sick, the old, the very young, women, and First Nations people. 20 million people are being displaced each year by climate-related extremes. As the COVID pandemic has graphically illustrated, health services and other sectors require a strong public health capacity to deal with this and similar problems. Consequently, at UNDA, we've just launched a new Master of Public and Environmentally Sustainable Health. This is a traditional MPH with a contemporary focus. This opportunity allows us to grapple with ensuring that a lens of environmental sustainability is maintained across the development of a whole new public health program. MPH programs are vocationally focused, which prepare graduates to protect and improve health at the population level and prepare them for a variety of essential roles. Consequently, this MPH will cover conventional MPH learning, such as epidemiology and the control of communicable diseases, but also acknowledges new areas of competency, such as systems thinking, to help people better engage with the complexity of public health problems. MPH programs are currently offered by many universities in Australia. In fact, there's at least 23, and also around the world. Unlike medical programs, the number of positions offered on these programs is not limited. Consequently, for the university to support a new MPH program, it is essential that any new offering provides a unique focus. As a first step, we completed an in-depth scan of the MPH programs offered in the states of Australia, sharing the geographic footprint of our university. And those states are New South Wales, Western Australia, and Victoria. This allowed us to develop a clear sense of what other programs out there are doing and how these currently include the environment as a determinant of health in their courses. From this, we could determine whether a gap existed that we could fill, i.e. where we could make a contribution through developing a new program. Currently, no other MPH program in Australia has a particular focus on environmentally sustainable health and healthcare. Some, however, do offer core and elective courses in this. Planning for the Masters has been guided and continues to be guided by a senior experienced advisory committee of public health practitioners with state, national and international experience in the delivery of public health services and education. They have also been at the front of bringing environmentally sustainable healthcare to the planning and delivery of healthcare systems, particularly in the state of New South Wales. One of the early challenges was to articulate what new competencies, in addition to the well-established core competencies such as epidemiology, health promotion, health policy, communicable disease control, were needed to better address the complexity of public health. Systems thinking and One Health are examples of these. These were developed, these new competency areas were developed in consultation with the advisory group and also through reviewing the literature. It recognises that many intractable problems, like obesity, are not responding to our traditional ways of thinking and our types of interventions. It's anticipated that most people seeking to engage with this program will be working part or full-time. So the course design seeks to be flexible, in fact, maximally flexible. Consequently, the master's program is a nested suite of programs offering multiple entry and exit points at the graduate certificate, graduate and master's levels. It's offered part-time over 3 years and delivered online by coursework. It comprises 12 compulsory courses, 10 of which are new and developed for this program. This slide lists the first 4 courses which make up the graduate certificate offering in public and environmentally sustainable health. We believe that this program may be of interest to health employers seeking to upskill their workforces and contains therefore what we consider to be the basic essentials. We do hope, however, that students will go on the whole journey for us, but these basic essentials are a new course, Contemporary Issues in Public Health and an Introduction to Systems Thinking, Scientific Literacy and Communication, Foundations of Epidemiology and an Introduction to Biostatistics, and Environmental Sustainability and Healthcare Systems. At the graduate diploma level, a further 4 new courses are introduced, and these are listed here on this slide. Being a Catholic university, ethics is a very important part of all our teaching. And so there is a separate course in public health ethics, in particular as it relates to environmental sustainability. And then at the master's level, the final 4 programs, we're pulling together communicable disease with One Health and disaster management, and taking it through returning to systems thinking. And all students need to do a professionally focused project across all 3 of the programs, and they bring it home, so to speak, in the masters. We commenced delivery of the first 2 courses in February this year, so we're very much in the very early stages of offering this. The new course, Contemporary Issues in Public Health and an Introduction to System Thinking, which I flagged before, engages students with the principles of systems thinking and the ways in which system thinking differs from mechanistic or reductionist thinking. Just have a drink. Mechanistic thinking is not suited to dealing with complex contemporary health issues. Through this course, students learn how different systems thinking methods can be applied to interrogate different kinds of public health issues. These methods help them to unpack what's going on and identify potential barriers. We've introduced new types of courses such as environmental sustainability and healthcare systems. Excuse me. Other courses are expanded, such as communicable disease control, to include One Health. Throughout, we recognise the importance of cultural competence to enable graduates to work more effectively with Aboriginal and Torres Strait Islander peoples for better health outcomes for everyone. We seek to recognise the impact of colonisation on the health outcomes of Aboriginal and Torres Strait Islander peoples, the history of trauma and loss, a topic not well understood in Australian education and by the Australian population, and the experience of racism affects opportunities for health. We are working with Aboriginal, Torres Strait Islander and Pacific Island colleagues to shape these offerings. A recent review of the content of MPH programs in Australia has identified the sustainability, the SDGs, One Health Systems thinking as new areas for inclusion in programs. So we've been very pleased to see this external validation of our approach. It's early days for us. We're still building this program. But as I've said, we've commenced with our first students. We've been very encouraged by the type of students we're attracting and their engagement with the courses. All of them are strongly motivated to make a stronger contribution to transitioning health systems to low carbon and low waste models of delivering, and come from a variety of professional perspectives: medicine, nursing, dentistry. Many of them have said that they've been looking out for an MPH program to engage with for a while, and engaging with this one because it aligns with what they're looking for. Positions with a focus on environmental sustainability are slowly emerging in health and are more established in other sectors such as local government. In England, the NHS has rapidly expanded positions with this focus and is considering including this in all position descriptions. However, here in Australia, in health and in health academia, there are very few people with the necessary competencies to immediately engage with positions like this and comprehensively fulfill roles. Our goal is to prepare our graduates for a broad range of these kinds of positions. Finally, I'm just going to run you through a series of slides, series of pictures. I referred at the beginning to a series of disasters that we've been through. And I'd just like to show you a series of images of the disasters that one community within a 50-mile radius has experienced, which is also about 50 miles from where I live. So in December 2019, Australia experienced 6 months of bushfires. This is a picture taken December 2019, one of a mega bushfire that happened in the Blue Mountains, one of the largest bushfires ever in Australia's history. This is taken on the 4th of January 2020, so just a week later, in the urban community that lives about 30 kilometres from where that picture was taken. And this is an urban heat map of Penrith. And on that particular day, the 4th of January, Penrith was the hottest place on the planet. And this is the same area a year later, during the first of a series of flooding events, which has been across the east coast of Australia. So this was in 2021, and you could take the same picture in 2022 of that building. In fact, that building probably disappeared in the most recent flood. We've just experienced the largest recorded flooding event in this particular area. So thank you very much for this opportunity. So I've shared two very different stories, one of medical education, where a sustained effort is supporting system-level change in medical education in Australia and New Zealand, and led by a collaboration of medical educators. And the other, a brand new program at a single institution that is being developed and rolled out in public health, one that reflects the new challenges to protecting and promoting the health of population, a master of public and environmentally sustainable health. Thank you very much indeed. Thank you, Hayley.
Thank you so much, Dr. Madden, for sharing your incredible programs. I'm especially intrigued with the Masters of Public Health program. You're absolutely right. We do need a skilled public health and medical workforce if we're going to, be able to confront this climate crisis. So thank you so much for sharing. And with that, I will pass it along to Professor Guinto. I hope I'm pronouncing that correctly.
Yeah, it's silent. You actually, so Ginto. Thank you very much,
Ginto.
Ailey, and to the consortium for this opportunity, and of course to Professor Madden. What I'm realizing is that Australia is several years ahead of many of us, and it's quite inspiring and instructive. We also have a plan to introduce a new master's program. We also wish to incorporate more climate change and planetary health into our medical education. And so I've been taking down notes while listening to Professor Lin a while ago. So I hope you can see now my slides. In the next several minutes, I'll be sharing with you some of the the discourse, the thinking around climate change and planetary health in the Philippines, how we are attempting to introduce these issues and topics to medical students and health professionals. Certainly, we are still at the, infancy stage in this journey, in this process. But I guess that's the purpose of the consortium, that we all learn from each other, exchange good practices, and see how we can collaborate so that we can all reach that state of having a health workforce that are ready and resilient for a climate future. So I know we already know in this room, or Zoom rather, the many different effects of climate change on human health. So I will not belabor you with the details of this diagram. But in the Philippines in particular, in terms of these different pathways by which climate change impacts health, storms certainly and flooding are quite familiar and central to our climate experience. Oftentimes we say that the Philippines is frequented by around 20 typhoons each year coming from the Pacific. But over the past several years, we've seen the number of typhoons increase, both and in frequency, but also increase in severity as well. And of course, when storms, typhoons, flooding do happen, there are many different impacts: destruction of livelihood, of healthcare infrastructure, emergence of diseases, even in temporary shelters, and sometimes even forced displacement of communities temporarily or permanently. And then drought is also becoming more and more experienced as well, which we know will impact food security and eventually the nutritional status of communities, including here in the Philippines. Heat waves is not really an experience, as well as the bushfires that unfortunately Australia has been experiencing. But there is a starting recognition that exposure to extreme heat is also going to be a public health problem. Unfortunately, it's not yet part of the country's national public health approach, but hopefully in the coming months and years, it will somehow be embedded, especially that now some cities in the country are reporting very high heat indices that we have never been seen before, at levels that have never seen before. So, and then of course, mental health is also a growing concern. There's actually one study that was published last year comparing 10 countries, and it was found out, according to that cross-sectional survey, that the Filipinos are the most climate anxious people in the world, especially the young people. And partly because of the experience, people are already experiencing climate change, partly because of the heightened level of awareness about climate change, even in media, even in our basic education, but also perhaps partly also because of the growing recognition of the failures of global and domestic governance in terms of acting on the climate. And so young people are very concerned about the kind of future that they will be inheriting in the next several decades. So the Philippines, as you can see, this is the map of Southeast Asia. Australia is just below this map. And unfortunately, in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, my beloved Philippines is the reddest of them all. So it really just speaks to the intense, the high degree of vulnerability of the country to climate change. And over the past 2 years, during this pandemic, we've seen the confluence between the two crises. One is COVID, the other is climate. And imagine you're a poor Filipino living in the coastlines or along the corridor of the typhoon, and you are experiencing or faced with this dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus? But my house might get inundated by intense flooding, or the roof might get blown away by the strong wind. On the other hand, do I move to these cramped evacuation centers, safe from disaster? But as you can see, there's no social distancing to begin with. Of this in the coming years and decades, if we will not get our acts together in terms of tackling climate change and preventing future pandemics. Okay. And so as a physician, I always see my work as treating not just one patient, but now two patients. On one hand, you have this little girl wearing a face mask, trying to protect herself from the unseen coronavirus. And on the other hand, you have Mother Earth also wearing a face mask, but of course, safeguarding herself not from the virus, but from the anthropogenic or human-induced changes that we are inflicting on her. And that's why, Professor Madden mentioned One Health a while ago, which I also embrace and espouse. And the other concept or approach that I, endorse and embrace, and I believe Professor Madden too, because she's a professor of planetary and population health, is planetary health. Again, we have two patients, people and planet. One needs to be healthy in order for the other to be healthy as well. And this pandemic really showed to us that our health systems are not ready for pandemics and certainly not ready for long-term climate change. So we should be using this pandemic to distill the lessons and incorporate them into our preparedness and resilience building to make sure that COVID-19 is the last pandemic of its kind, and that the climate impacts are addressed and tackled. Unfortunately, yes, we need to continue mitigating climate change by being more ambitious with our emissions. We have a deadline, which is 2030. But given the slow pace of action, it seems that the health sector, will also need to start preparing for the worst, because some of the impacts are already being felt now, and some of the impacts, sadly, will also probably be inevitable. And so are we ready to build health systems that consider the climate? And I think to answer this question, medical education, health professions education in general, are quite important and vital. And a while ago you heard from the efforts in Australia. In the coming slides, I will be sharing some of our little efforts to introduce these ideas, and hopefully we'll be able to expand more in the coming months and years. So first, the St. Luke's Medical Center College of Medicine has been existing for 120 years. And we have a medical school that is a quarter of a century old. But the medical school and the hospital have for decades focused very much on clinical care. And so the COVID-19 pandemic, but also the increasing recognition of the climate crisis, provided the impetus for the medical center to build the Planetary and Global Health Program, which I head, and which is the first of its kind in an academic medical center / medical school in the country. And so we're really innovating, pioneering stuff here in this new program. This is our, kind of motto or slogan. We want to be connected to the world. That's why we're part of the consortium. We care not just for people, especially the patients who come to our hospitals, but also for the planet on which our healthcare and our people's health truly depend. And we are also committed to the future. We are not, medical doctors, health professionals. The tendency is to focus on the present, the emergency that is at hand, and that is legitimate. That's valid. But I think in the era of planetary health, in the era of the climate crisis, we actually now have, this new imperative to also think about the future, the long term, the children who are yet to come. And so what are the things that we've done so far in the past 2 years? We launched a new elective program in the medical school. It's very hard to actually inject more content into a very overwhelmed and very crowded medical curriculum already. Before we started this, we already had some climate change content around 2 hours that is being provided to first and second year students. And then we created this elective so that we can also provide more platforms for learning for those who want to increase their knowledge and experience in these specific areas. But hopefully we will be able to incorporate more content into the basic curriculum so that all medical students, and not just the ones who did their elective, will be gaining a good amount of knowledge and information that is relevant to their practice. And so I actually appreciate Professor Madden's discussion a while ago about competencies. That is something that we still have to figure out. And the competencies are both global. We want all health professionals around the world to be aware and then they understand climate change. They know what a climate smart or a climate resilient health system is. But some of the competencies perhaps will be very contextual and local, because climate change manifests differently in various places. I already mentioned the term climate smart healthcare. Very briefly, climate smart is the convergence between mitigation, reducing our emissions, and adaptation, which I summarize as bending without breaking. The ability to adapt and respond to the health impacts in particular of climate change. And this is the framework that was introduced by the World Bank, also espoused by the WHO, that we've been trying to promote here in the Philippines among health professionals. And so actually in June, we will be launching our first ever certificate course on climate smart healthcare in developing countries. And so our target is health professions leaders, hospital leaders from the Philippines and Southeast Asia. This course will have more emphasis on what can be done in low and middle income country settings. Because, if you Google climate smart healthcare, a lot of the examples are from high income countries, Europe, North America. And I think it's high time to also come up with a course and a knowledge bank of good practices also coming from low and middle income countries. And then also in this May, our medical school is hosting the national conference of all medical schools in the Philippines this year. And so it's really a perfect opportunity to introduce climate change and its incorporation into medical education in this conference to the to the medical school deans and other education leaders. And I actually thank the consortium, both Haley and Cecilia, for saying yes to our invitations to also address the Philippine medical education community, both in May and in June. And this one is the pre-convention event that Haley will be participating in, which is a pre-convention workshop on integrating climate change and planetary health in the medical curriculum. So, I guess this presentation is just what they call this, the drum beat, that event that will be happening in a few weeks' time. But also it's very important that, yes, we are teaching climate change in medical school to medical students, but we also need to walk the talk, because I think experience is a great teacher as well, if not better, if not greater. And so in St. Luke's, we started these small projects. This one, we're working with the University of California to help several municipalities build climate resilient local health systems. So these local health systems are the ones that will be receiving our medical graduates after they finish med school. They will be joining the workforce. And so it's important that we both address, the supply side, producing climate ready health workers, including medical students, but also the demand side or the infrastructure side. What is happening in the local health system? Are there plans? Are there budgets? Are there information systems? And so this needs to be part of our work in making sure that our health sector is ready for future climate change. And then, as I mentioned, we are doing the baby steps in terms of education, but we cannot wait for curriculum to be ready and finished in order to start teaching and raising awareness. And the other ways that we can do that is by creating communities through advocacy, through, over this past 2 years, there have been hundreds of webinars that have been organized by colleagues, and many of them on climate and health, in particular among medical students. If there is no such offering in their school, they're actually the ones taking the initiative. And so we have to also acknowledge that medical students and medical student organizations do play a critical role in advancing the goals of the consortium. And one of the communities that we built over this pandemic is Planetary Health Philippines. I invite you to visit planetaryhealth.ph. And through this platform, we've been organizing learning events, webinars. They're not part of the curriculum, but we are raising awareness and disseminating knowledge among our community members. So just to wrap up, we're still in the middle of the pandemic. I think some are concerned about another surge in the coming weeks and months. But I think we cannot wait for the pandemic to be over to start acting on the climate and to improve planetary health. And so I hope that we will be using the post-COVID recovery. Actually, I think maybe there's no such thing as post-COVID anymore. But we need to make sure that this process leads us to a green, healthy, and just future. We cannot go back to the old normal because that's certainly abnormal. Fundamentally is being taught to us, health professionals, medical doctors. I'm sure in the field of medicine in our community, we always think, or some people think that, we are kind of, proud and, at the top of other professions, etc., of the community, standing on a pedestal. But I think planetary health is teaching us to become a bit humbler, to shift away from an egological perspective and to shift towards a truly ecological perspective, seeing ourselves as being part of nature, the web of nature, living in greater interdependence with other creatures, great and small, and in solidarity with all other professionals, disciplines, sectors, because to advance planetary health, we really need the collaboration of everyone. And we're doing this not really just for ourselves, but for the children, these children carried in these containers to be safe from both COVID and climate. This is a picture taken here in the Philippines in the middle of both a typhoon and a pandemic. We owe it to these children, and we owe it also to the children who are yet to come in the distant future. So together, let's advance the health of people and planet. Thank you for listening, and I look forward to our conversation.
Thank you so much, Renzo. That was absolutely incredible. And you sort of mentioned that you're taking these, small steps in the Philippines, but they are absolutely in the right direction. And yeah, it's just incredible to hear about your programming that you have going on. I guess we can open up the floor for any questions to either of our panelists. If anybody has any, please feel free to unmute. I'm just hoping we can have sort of live discussion here.
Renzo, I've got a quick question for you. I'd be interested to know what barriers you may have experienced in the work to date and some of the ways you've found around those barriers, or you may not necessarily have found ways yet around them, but I'd be interested to know and understand some of the challenges you've faced.
Thanks, Lynn, for the question. I guess one barrier is, so for example, there was a time when the issue was not yet front and center among the medical community, health professionals. There were only 10 Renzos speaking about it, and initially it was hard. You thought that health professionals will easily get persuaded, right? Because it's quite intuitive. What happens to the environment affects our health. But initially, it was not more of a resistance, but more of a we can work on it next year, or in 2 years' time. There's no sense of urgency. I guess that's one challenge or problem. But I think, especially during the pandemic, when everybody is now talking about the importance of our health, and that not just the population's health, but also the planet's health, then you've seen medical societies beginning to really take this seriously. Over the past 2 years, I've spoken to, the psychiatrists and the surgeons and the different societies. So even in their conferences, it's now becoming talked about. So it's not yet in the curriculum, but they're already discussing it. There's already a recognition in the non-curricular platforms of different societies, health professionals, the nurses included. And then the other, I think, is there's just so much what do you call this? There's so much happening, and again, I think it's related to the urgency question. Then now, despite their plates being so full, especially during these COVID times, everybody's very busy. They're beginning to recognize, no, we can't keep on delaying the climate, our attention on the climate, because there's a sense of urgency and there are deadlines. So I guess those are just some. And now I'm very pleased that even the incoming president of the Philippine Medical Association has expressed explicitly that she will put climate change and planetary health as central in her agenda during her presidency. So those are some good signs. Thank you.
Thanks, Renzo. Haley, if I just comment, one of the reasons for highlighting that multi-college report on climate change and its effects on healthcare systems in Australia right at the beginning was that has been a very powerful way of bringing medical colleges together and discovering a collective agenda. So that was one of the reasons for flagging that particular recently published piece of research to people on the webinar this morning. Thanks, Renzo, very much.
Yeah, thank you. It's funny that you mentioned that one of your biggest struggles is coming from siloing of health professions oftentimes, and I think this has been sort of a grievance from a lot of conversations that I've been in. You have like a nurses working group, and they're just beside themselves, like we're doing all this in nursing, but we want to know what the medical professions are doing. We want to know what social workers are doing, and this will take an interdisciplinary effort to solve. But anyway, sorry, I'm kind of rambling, but I have a question for both of you, I suppose. I don't come from a background that involves medical education, and oftentimes I think one of the problems that we have come across at the consortium is that medical education is just absolutely jam-packed. Like there is very, very little wiggle room for new content. And I guess I'm just curious, like how has that experience, like how has that changed your curriculum reform process to incorporate planetary health principles in foundational medical education? That was a bit long-winded, but
that's all right. I'm happy to go first,
yeah.
Renzo. That's one of the reasons why I think that the approach that we've taken here in Australia and New Zealand has been really useful. The way it played out in the end, which was it was about strengthening the environment as a determinant of health. So basically, we engaged students with the social determinants of health, and it was about expanding that to include a stronger focus on the environment as a determinant of health, which was, as I said, standards are silent on it. So it wasn't about packing in lots of new graduate outcome statements. It was actually simply about modifying. In fact, many cases, I didn't show examples, but in many cases, just actually minor modifications. So if you're teaching students about prescribing, then part of the suite of things they need to be thinking about is not only the cost of prescribing and the side effects, but also the environmental damage that potentially their prescribing practices may cause. So it's, in most cases, it's simply about expanding the lens of your existing teaching. We find that I've found anyway, that as I've mentioned at our school, ethics is a part of all teaching. It's no problem at all to include the ethics of climate change inside ethical case studies. There's plenty of them there. And similarly, when students are out starting to do their work in clinical placements and are being engaged with by, specialists like anaesthetists, the anaesthetists are quite happy to have a chat with the students about desflurane and how we shouldn't be using desflurane, and that, look at the end of a procedure, look in the operating theatre, look at how much waste we've just created, and let's think about how we might move to lower the environmental footprint as well as the carbon footprint of what we do in medicine. So I think the success for us, Hayley, has been not about jamming lots of stuff into the program. It's been simply about saying we need new ways to think about the way we do our business. We can't continue to deliver healthcare in the same old way. And we've got a very, very short period in which to start thinking about doing this differently, literally 2030. So that's the way we've approached it. And as I said, the paper that we've written is open access. You're all very welcome to take it and do with it what you wish.
Yep. Just to add, I think climate change in medical education should not begin and end inside the classroom. So yes, we can provide them with basic content through a lecture or through an asynchronous, recording of a lecture, giving an introduction on what climate change is, how it's impacting health, what is the role of the health sector. But I think we need to start, and I guess this is what Professor Lin was also referring to, start looking, mapping the entire curriculum and see where can we insert climate change. When we're having a pharmacology module, maybe we can start having an additional content on the impacts of climate change on the efficacy of medicines, but also green prescribing, so on and so forth, or in other specialty modules. And then, of course, these medical students eventually will be entering the hospital and the healthcare facility. And there should be no disconnect between what they're learning inside the medical school and what they will be encountering during their clerkship, internship, and in later years of medical training. And so, it's going to be, antithetical if they're learning about how to be a better and a greener health professional in the medical school, and then practicing unsustainable, or doing unsustainable practices during healthcare provision. So those are just some of my insights. Thanks.
Thank you. That sort of begs to what you're talking to earlier about walking the talk a little bit. Yes. Teddy, would you like to unmute and ask your question?
Sure. Nice to hear from my colleagues and what's how you're leading in the Eastern Hemisphere. Really very exciting. And thank you for being such wonderful examples for all of us. Are either of your programs talking about, in sort of broadly, it sounds like you're decarbonization, especially scope 3? It seems like scope 1 and 2, where we're turning out the lights and working on, a production of gases, et cetera, are things that we're talking about. But how about supply chains and the things we're actually purchasing and using? Are either of you doing that?
Teddy, I hope that the Masters of Public Health will.
Mm-hmm.
As I said, we've only just started in February this year, so we're only in the stage of running the first 2 courses. But certainly in the course about environmentally sustainable healthcare, which is running in second semester in the grad cert, certainly we'll be looking at the whole of the scopes in that. We haven't run that program yet, Teddy. I'll let you know how it goes.
Yeah, please do. I'll be watching you. Thank you so much.
Teddy, hi, Teddy. Nice to see you again.
Good to see you, Renzo.
Yes. Scope 3 is quite a challenging, area, right? In terms of healthcare decarbonization. You talk to health professionals and it's easier for them to grasp the energy side. But then when you start talking about the other aspects of healthcare, you basically receive, quite a surprising, or a response of surprise. Oh, we didn't realize that even the food that we are providing to our patients and staff are also emitting carbon, and that should be counted on us. So I think there's a lot of education that still needs to be done. But I think the lowest hanging fruit among the scope 3 sources of emissions is healthcare waste. And among Philippine hospitals, there's a growing, recognition that we need to address healthcare waste management, especially during these COVID times when there were a lot of, PPEs and now syringes being used as part of the pandemic response. And so I guess those are just some of my insights regarding scope 3. It's a difficult battle, but we need to keep on persisting.
Thank you.
And if I could just add also to what Renzo said in response to Haley's question, sorry, not Haley's question, Teddy's question, sorry, Teddy. What's been really helpful to us is the fact that both the carbon and the environmental footprint of the Australian healthcare system has been measured. And so when you're having a conversation with people, you can actually put up a pie chart. And it really grounds the conversation, and people find it much easier then to start talking about things like procurement.
Right.
Up until then, it sort of is something that somebody else does procure. And of course, the NHS is the example par excellence, where they're really, as you know, Teddy, sort of driving the last big phase of decarbonisation through the control that they're exerting over procurement. So, I mean, like the answer to all of our challenges is to keep talking to each other, because someone somewhere has at least had to think about how to engage people with the issue, and the NHS tends to be my go-to, I must admit. Haley, Michelle's got a quick question.
Yeah, more just a comment than a question. I've just put a note in the chat about the AMI consensus statement, a very good resource. 35 people from across the world came together, including students, and put that together, lots of LOs and activities. It's a good go-to document. I think it's now, you've got to pay, but I can send you a copy if anyone wants. Just email me, the email is there. And just in terms of the conversation, how do you get this in? It's not about adding to the curriculum, it's around integrating it. And that's exactly what I've done all the way through. So we take planetary health, of which climate change is just a small part of that, and changing things, like instead of having the biopsychosocial model of healthcare, we have the eco-biopsychosocial model. It's grounded on a strong sustainability model with the environment on the outside. And we also base it on Indigenous principles of custodianship of land. And so going back to that is that we're not at the top of the food chain, we're part of the ecosystems and the environment. And for us to continue, we have to be giving back to that environment and looking after it. And in terms of that, what the conversation has been, so health professionals need to do X, Y, and Z. So that's professionally. But and at work, that then translates into role modeling good practice later on. It's not a switch that flicks off. Oh, now I'm working in the hospital, I have to do this. You should be doing and embracing it. The current decade is the decade of restoration, and it's the decade of reconnecting with nature, back to Indigenous principles again. And so if we think of that in terms of the green side of things and restoring our relationship with nature, it's a perfectly good planetary health perspective and framework to use.
Thank you, Michelle. Thank you for putting that resource in the chat. I would personally myself like a copy of it, but I can follow up with you through email later. But it looks like we're at the top of the hour, but I just want to thank both of our panelists today for sharing your immense knowledge and expertise with us today. And it's been a pleasure to learn about your initiatives and learn from them in the climate and health space. So, and thank you to all of you for being here today from wherever you're calling in from. And yeah, and with that, we can conclude.
Thanks, Haley, very much indeed for organising
Thank you
it.
So much.
Just a shout out to all the Australian colleagues who've joined.
Hi, sorry. How come I got the time? How come I calculated the time wrongly? Is it that I supposed to be Malaysian time 9 o'clock, 9 a.m.?
Oh, apologies. I think something must have happened with the daylight savings time transition, and it just got shifted an hour. So apologies if that was any inconvenience to anybody. But yeah, we'll be recording of this session as well. Yeah, this session has been recorded and we'll post it on the website for everyone to watch.
Okay, I'm so sorry. I'm so sorry.
Yeah.
I got the calendar conversion and it is 9 o'clock. Yeah.
Maria, time zones are an absolute challenge, aren't they? I think we've all did it. I checked the time for this morning about 12 times over the weekend.
How to avoid this? How to avoid this next time? Because when I registered